Well, we can get started. We'll let people keep coming in as they need to. But if you're just joining us, hi, my name is Ashton. We have some familiar faces, which is great, some familiar faces to our webinar conversations. With me today is joining my co-founder is Kirsten. You may also recognize her for some of the auto feed pieces. And then our special guest and our lovely friend, Dr. Ayana Warren, will be leading us through some really cool pieces on ulcers. We feel like this is a really timely conversation. There's a lot of information coming out right now that ulcers are quite prevalent in our sport. For any horses that are, training, traveling, and being asked to be those, again, winning animals, we really want to make sure we're looking after them. We think there's like a personal tie to this too. Kirsten and I have both had now horses with ulcers, and I actually just went through a scope with one of mine, which was really eye-opening because I had this young horse. I've had him since he's 1. He's this beautiful Dutch warm-blood Hanoverian guy, and I started him, and he kind of was a little bit girthy, and then he was a little bit kind of, saying no when I asked him to kind of, move off my leg, and then he's also been injury prone, and he's been on, some medication to kind of help him get through some moose encounters and some, dangerous things for little guys. And we did a scope, and it taught me a lot. And I think this recent conversation about how we can just manage our horses better is super, super important. So, Dr. Warren, I'll hand it over to you if you want to introduce yourself and kick off this conversation.
Well, thank you very much, Ashton, and thank you very much, Kirsten, for having me today. I'm very excited. Um, yeah, my name's Dr. Warren. You can tell from the silly accent, I'm from the UK originally. Ulcers are something that's pretty close to my heart as well. I have had horses with pretty nasty ulcers. I was hoping to share some images from I also did a scope yesterday on one of mine, and I was hoping to be able to show the before and after images, but unfortunately I wasn't able to get them off our new scope in time. Yeah, hopefully I'll be able to share some cool things today, and if anyone has any questions, fire them at me. There is also a Q&A session at the end, if there's anything that's sort of a little bit more in depth that we can kind of go on to a bit more of a conversation about, if anything kind of comes up. So, okay, I got to figure out how to share my screen again. So, this should be it. Okay. Can everyone see my screen?
Yep, you betcha.
Yep. Okay, beautiful. So, welcome everyone. We're going to be talking about equine gastric ulcers today. As my lovely co-host introduced me very, very nicely. My name is Dr. Warren. That is me, and that is Venus. So the reason her photo is in here because it was her that I was going to show the before and after, but unfortunately that's not going to happen. So I had to borrow some photos from the internet. So I do apologize. I do apologize for that. But today's presentation, we're going to cover sort of what is equine gastric ulcer syndrome, or EGUS. We're going to talk a little bit about the anatomy and physiology of the horse's stomach, and what that actually looks like, what the sort of different types and grades of ulcers actually look like on the inside. We're then going to talk a little bit about what actually causes them to develop and to get worse, and how to spot them, or how to spot the signs that a horse might have some ulcers. We're going to talk about how to diagnose them and treat them and manage them and prevent them. Kind of all of the things, because unfortunately they are a pretty common problem amongst horses worldwide. So fingers crossed, after today we'll be able to help mitigate that a little bit. Now, just a heads up, there are a couple of gory photos in here. So if anyone is of a squeamish disposition, just giving you a little bit of a warning. They're not awful, but at the same time, I'm kind of used to these things right now. So yeah, just a heads up. Okay, so equine gastric ulcer syndrome, aka EGUS. Ulcers are basically where the stomach lining erodes away, and it's obviously very, very painful for the horse. It's also very, very, very common. Depending on the population of horse that you're looking at, up to 90% of horses can actually have ulcers. They are sort of more common in your competing horse populations, so your race horses, your sort of your athletes, but any horse is at risk. Venus, the little quarter horse mare that I had a photo of just now, she developed grade 2 ulcers from existing in a field. That's all she was doing, and she got them. And yes, they can have a massive impact. Not only can they affect the physical health and then, the behavior of the animal, and actually the behavioral effects of ulcers can potentially have really long-lasting effects. If a horse has gut pain for a really long time, then even when you treat and fix that gut pain, if they have developed a guarding behavior, if they're anticipating pain, they can still have behavioral changes. It can affect their performance for obvious reasons. It can obviously be a welfare condition. And when we're talking sort of high value horses, they've got a job to do. If they're not performing to their full extent, then that's obviously a financial concern. But on the flip side of it, treating ulcers, especially some of the really nasty ones, they take time and they can be expensive to treat. So it's a lot easier to just prevent them where you can and catch them early where they can't be prevented. So that's a lot better for us as horse owners as well. So talking about the physiology of horses. So horses are grazing species. They're prey species and they are supposed to be eating anywhere between 10 and 18 hours per day. Because they are supposed to be continuously grazing, that means their stomach is going to be continuously secreting that stomach acid. And it's also going to be continuously buffered. So as they're chewing this plant material, as they're working to grind down these stalks of grass or hay, they're going to be producing a lot of saliva, which they then swallow with the grass or hay. And that saliva has bicarbonate in it, which helps to reduce the acidity of that stomach acid. They also have a belly full of food all the time, which can help prevent acid sort of splashing around. It can, for lack of a better way of putting it, soak it up. Kind of makes it a bit more soupy rather than a bit more watery. So that's sort of how it's supposed to be. Looking at the anatomy of the horse's stomach, so there's a really nice cartoon here. The top half is called the non-glandular or the squamous part of the stomach. And this is actually really quite delicate. It's got the same kind of coating as the esophagus. So it doesn't have any defense against stomach acid. It doesn't produce the acid, but it also it's very vulnerable if it gets splashed with acid. There's a very obvious line, there's a very obvious demarcation. It's called the Margo plicatus, and that will win you every time in Scrabble, I promise. That separates the squamous region from the lower glandular region, which is where that acid is actually produced. Now, the glandular region does have a little bit of defense against stomach acid. So thankfully, the ulcers in this region are just a little bit less common because they're a little bit harder to treat because they're a little bit lower down. So yeah, it's they do have a little bit of defense, but that doesn't mean they're impervious. So I'm going to put up a potentially gory photo next. So this is the cartoon of the horse's stomach up against a photo of a horse's stomach that I borrowed from the Journal of Veterinary Medicine. And you can really see here the nice pale pink top half and the slightly darker pink bottom half. You can see that really obvious line, the Margaret plicatus there. This is just to kind of give you a kind of a mental image of because we're gonna look at some endoscope photos next to just kind of give you something to orientate yourselves with. So again, there's going to be a couple more potentially gory photos over the next couple of pages because we're going to look at what actually some of those ulcers look like on the inside of the horse's stomach. So this is focusing very much on the squamous ulcers, so the top part of the stomach there. And unfortunately, again, shameless borrowing from the internet because I wasn't able to get the photos that I wanted to put on here. So they are a little bit blurry, and for that I do apologize. But I do think you can see, I think it gets the point across. So with our, I'm hoping you guys can see my cursor here. With the grade 0, everything is nice and smooth and nice pale pink. It's that bubblegum pink. And there's really not any chunks missing. There's not any sort of abnormal coloration. The grade 1, it's not super duper clear, but you've got a couple of focal points in there where it's just not quite as smooth, just not quite as nice. Anything above a grade 2 is considered clinical. And I think it's pretty obvious here. We can see the squamous region, that nice pale pink. We can see the glandular region. We can see that margo plicatus kind of separating the two. And then we've got these red, angry looking kind of welts just above that margo plicatus. And that's a pretty common place to find them. And that's most likely just from that stomach acid kind of splashing up onto that delicate tissue that doesn't have any defense against it. And then you can see with the grade 3 and then the grade 4, it just gets worse and worse as the picture goes along. We're getting more of them, deeper, angrier. It's by the time you're getting up here, that horse is going to have one heck of a tummy ache. Moving on to what the glandular ones look like. Sometimes these are also referred to as pyloric. The grade 0, nice and healthy, nice and smooth. Everything is sort of shiny and there's nothing sort of abnormal in there. Grade 1, it's starting to get a bit blotchy. And then when we get onto the sort of clinically significant ulcers, you can appreciate, even in this blurry photo, we've got some dots of red in there for the grade 2. And then grade 3, the difference is sometimes it's how deep they are, sometimes it's how many they are. And the same goes for grade 4. I mean, you can see that's pretty nasty looking right there. That's a pretty bad ulcer right there. So again, if you're up here, that horse is going to be feeling really rather pants. So what actually causes that progression from grade 0 to grade 4? Well, there's a lot of different things that can actually contribute to the risk factors and to the progression. So one of the biggest ones is that lack of saliva buffer. So if that stomach acid is getting super acidic, then it's obviously going to be much more potent. And one of the biggest causes of this is just a lack of consistent grazing. And the two kind of examples that sprung to my mind, if you've got a horse in a stable and you can give it the biggest hay net in the world, but if it eats it all in an hour and then it's sat for 11 hours not eating, then that's obviously a little bit less than ideal. But it also, even in particularly more so I suppose here in Canada compared to the UK, in the winter, even those horses that are turned out that in theory should have consistent access to grazing, well, if there's 2 foot of snow, they're not going to be able to get down to that grass. So if we're not able to supplement with hay often and consistently enough, then they're also going to be going for quite a long time without food. And that's going to have the added stress of the cold, putting sort of physical stress on the body because they're not going to be sort of fueling the fire and keeping warm through that fermentation. Relying very heavily on high concentrate diets. Now, high concentrates are often very beneficial to our horses. They give them energy. They can balance their diet. They can fortify it with sort of minerals and things that may not be naturally occurring in the forage. But the problem is they don't take a whole lot to chew, and it really is that chewing and that saliva production that helps to buffer out that acid. The other thing is a lot of concentrates actually pass through the stomach very quickly relative to grass or hay. So again, it just leaves them with an empty stomach for a little bit longer if that's kind of what we're really relying very heavily on for their calories.
And are you referring to that's like grains, right? Like all your complete feeds, your like, different steps and stuff like that?
Yeah, I mean, grains do have a particularly sort of bad reputation with regards to ulcers. But it isn't just grains because, of course, any concentrate is designed to be easy to eat, right? That's kind of the point. So I'm not demonizing them because they absolutely can be beneficial. It's just being aware that if we're relying solely on them, then that can, for all of the good they do, there can sometimes be some negative effects as well. Um, Obviously, sort of moving on to the next point with the poor teeth, if you've got a horse with no teeth and they can't chew on that saliva, then you absolutely need a sort of a complete concentrate because otherwise what are they going to eat? They can't get anything into them. But again, it does mean that there's that less sort of saliva buffer, which can be a risk factor for ulcers. I hope that answered your question there. Yeah. Okay, good. Okay, and then so intensive training. So this is a if you've got a if you've got a lot of sort of physical movement, especially on a sort of somewhat empty belly, you're obviously going to be getting some of the acid sort of splashing up into that squamous region. And the combination of the kind of high concentrate diets and the intensive training is one of the reasons that we see ulcers so prevalent in sort of racehorse populations, because obviously they need those concentrates for the energy, but they're also working really, really hard. And so there's this kind of perfect storm there. And that's why it's pretty common amongst those guys.
I actually have another question about that too. So it's common in the hunter jumper world, to kind of like, you have to feed your horse at least like they have to be done eating 2 hours prior to, your show time or that time that you're going to get on. How fast is gastric emptying in a horse?
So that's a really good question. And when we're talking sort of more forage, honestly, if you're gonna fast a horse for like a gastroscope, you will typically be fasting them for anywhere from 12 to 18 hours in order to get a fully empty stomach, when when you need it completely empty. Um, Different concentrates are going to empty a little bit faster. Like some, it could be just a couple of hours. But one of the pieces of advice that's kind of, I guess, maybe a little bit newer is to actually feed a flake of hay, like about an hour beforehand, because you do just want just a little bit of something in there. But as you've pointed out, you don't want something super heavy in there. You don't want your heavy big meal of concentrates because it's going to make them sluggish. It's going to sit heavy in their belly. Um, I hope that I hope that makes sense. Yeah. Okay, good,
That's
good.
great. Thank you.
Um, so stress in general can be a risk factor, both sort of mental stress and physical stress. So transporting competitions, as you just said, lots of new things, lots of new places. Some horses cope better with it than others. And then, of course, the physical stress. We spoke a little bit about the intensive training. We spoke a little bit about the harsh weather. Um, and actually, I put stabling under stress because every horse is different, but the the natural horses are herd animals, so the sort of natural behavior of a horse is to be in a herd, to interact with other members of its own species, to have its head down and be kind of walking around the field grazing. So when they are stabled, especially if they're stabled for a long period of time, they're not necessarily able to interact with other members. They might be able to see them, but they might not be able to get in there and groom each other, or sort of stand together and nap together. They might be sort of standing with their heads over the stable door, which might not be. Hi, sorry, my horse-sized dog has decided he wants to be part of the presentation. And of course, sometimes they don't have any choice over who they're actually stable next to. I'm sure we've all seen those videos, or we've seen it where they just don't get on with their neighbor, but they're not able to move away. So sometimes that can be a cause of stress as well. Non-steroidal anti-inflammatories, or NSAIDs. So that's a big one. Everyone's probably familiar with phenylbutazone or bute. or flunixin, which the brand name Banamine. I think a lot of people are pretty familiar with those. There are others out there, but those are the big ones in the horse world. These can be risk factors because they basically thin the stomach lining, and that can, you know, for obvious reasons, that can then make it more prone to damage. But we do still need anti-inflammatories because pain and the stress of pain can also be a risk factor. So if you've got a painful horse, let's say it's got laminitis, you know, it can't exhibit those natural behaviors because it's sore, it's painful, so it's probably not eating as much. It's physically stressed because of all of these things, and then you're throwing in those anti-inflammatories, which are necessary because it's got a painful inflammatory condition. It's a perfect storm. So sometimes it's just like all of the factors come in together, and sometimes you kind of can't get away from you can't get away from it. So how can you actually spot? We've looked at what they look like on the inside. How can you actually spot it from the outside? Well, there are some people that say, you know, because they are so common, if you can spot a horse, you can spot a horse that might have ulcers. But the reality is, it's not always that straightforward. Some horses are extremely stoic and they could have horrendous ulcers and they just do not show it. Others are perhaps a bit wimpy and they are very much more expressive, and you know, they might have very low grade ulcers, but they feel it very heavily. And perhaps wimpy is the wrong word there. I shouldn't invalidate them and because obviously they maybe just have a lower pain threshold. That's what I should have said. But yeah, it's not always obvious. There are a few sort of classic signs that we might look for, typically sort of girthiness or reactivity when tightening the cinch. That's a pretty classic one. Changes in performance or behavior, weight loss, looking just a bit rough around the edges, you know, a pretty dull coat, a brittle coat. They're some of the classic signs, but as you can see here, there's a whole bunch of different signs that they may or may not show in varying degrees. The two horses that I scoped yesterday, one of them, very, very, very girthy behavior, like very reactive around that area. And actually, when we scoped her, she did have a couple, but they were pretty small. They were pretty minimal. They were grade 1.5, maybe. Her companion, so same owner, and I have to say this particular owner's management was flawless. I didn't have any critiques for her. She was really, really good. She knew what she was doing. So same owner, same management. The other horse had no signs. It was a routine scope just for preventative measures. And actually, when we got in there, he had pretty diffuse grade 2 ulcers kind of all over. But he just didn't show it. So they don't like to make it easy for us.
Wow, that's so interesting. Like, what a good example, too, because I think we want to always be proactive with healthcare and our horses, but then you just have to kind of go a layer deeper and maybe just actually do the scope to get to the bottom of what your horses, have going on in there. That's really interesting.
Certainly, if you have, especially, you know, if you've got big plans for a horse, if you know you've got a really heavy show season coming up, or maybe they had just a tough winter, like it's never wrong to just check, because we know that they're so common, and we know that if left untreated, they can get worse. So it's never wrong, and it's not it's not as invasive, I think, as some people might think. You know, you're popping a small tube up their nose. Um, Obviously, you will sedate them because you want it to be stress-free for them, but it's it's you know, I've stomach tubed horses completely conscious before with colics and things, and they kind of lift their lip and they kind of, you know, it tickles a bit going down, but actually once they swallow it, most of them are like, oh, okay, then they really a lot of horses are really mellow for it. So yeah, it's relatively, I say relatively, I don't think it's too nasty of a test, all things considered.
No, I think it's quite quick. Like I've had horses in both situations, the stomach tube for the colic and the scope recently, and it was so efficient. Got in there, took the photos, and it was done. So it was, yeah, quite an impressive process actually.
Oh yeah, absolutely. If you've if well, we were talking about, with the Game Boy and getting it in. Once you get pretty hot on it, once you get someone who's really good, and especially if you've got a really good quality scope, you can do a complete exam in 15 minutes. Sometimes it's really good. And then you get those really nice you get the photos or the videos, so then you can actually track as your horse is as they go on treatment, or if you do it sort of routinely, you've got that record then of what they looked like, and you can use that to measure how effective management changes are, or treatment changes. So yeah, as you can tell, I'm a big fan of the scope. I like the scope. And actually that comes in really nicely to our next slide. Perfect timing. So when we talk about diagnostics, there are a couple of things that people like to do, and there are things that might be recommended. And obviously, every individual you're going to assess as an individual. Sometimes, not all the time, and not reliably enough that I would say that it is a genuine diagnostic for ulcers specifically. But sometimes, if you've got a horse that's maybe not quite doing right, you might start with a blood panel to just kind of get a general lay of the land. Sometimes you can see markers that might indicate ulcers. It's not a guarantee. You can get mild anemia for a bunch of different reasons. It doesn't necessarily mean that it's definitely bleeding ulcers, but sometimes it can kind of point you in that direction. Trial treatment. So this is that it's a love-hate relationship with trial treatment, because you can get if it works, great, fantastic, awesome, the horse feels better. But if it doesn't work, why didn't it work? Is it because let's say you had some grade 4 glandular ulcers and you gave them 4 weeks of omeprazole. Well, did it work? You might not get a whole lot from that. With that's severe and nasty ulcer, and you kind of just giving it like a baseline treatment, you might not see a huge improvement on just that. So then if you're using that as your diagnostic tool, you might shrug your shoulders and go, well, it's not ulcers then. Well, no, it was ulcers. It was just that the treatment wasn't quite enough for that specific type of ulcer. You do also occasionally get like the placebo effect, not so much the animals themselves, but we as humans are very prone to wanting to see a benefit. If we do something, we often want to see a benefit for it. And anecdotally speaking, I find that often comes correlated with how much we've spent on it. So if we spent quite a lot of money on it, we really want it to work. And sometimes we can almost talk ourselves into seeing a change, even if actually that change isn't really that much, or even if that change is maybe even it's correlation, not causation. What else did we do at the same time that might be making a difference, rather than necessarily the sort of trial treatment. So yeah, I like the gastroscope. You get eyes on, you can see it, it's there, you can see where, you can see how many, you can see how bad. And from that, it's much, much easier to go, yep, okay, you got this grade in that location, take this treatment, let's see how we go. Rescope in a couple weeks' time. Oh, look, it's getting better. Great. We know this treatment is working. Or occasionally rescope a couple weeks later. Okay, it's maybe not working as well as we hoped. Right, let's change it and let's make sure that it is working, so that we're actually fixing the problem. And I love this photo here. So this photo is the only photo I was able to get from yesterday. This is my lovely veterinary technician, Mackenzie. And this is her horse Red. I was originally trying to do a thumbs up in that photo. That's my arm there. And we've got the scope in now. Spot the deliberate mistake. Mackenzie's not wearing a hard hat, and Red is not wearing a gag. The scope that we've got actually goes down a nasogastric tube, so that's why he's not wearing the gag, and that's why she's not wearing the hat. I promise. If we use the gag, I do make her wear a hard hat. I don't like anyone having a head injury. Okay, so we've diagnosed our ulcers. We know what we're dealing with. How are we actually going to then fix them? Well, everyone has heard of omeprazole. Everyone knows omeprazole, and that is because it really is one of the biggest chunks of treating ulcers. And it works by actually suppressing how much acid is secreted in the stomach. Now, the most common one that a lot of people are familiar with is GastroGuard. It's an oral paste. It's designed and licensed specifically for horses, and it's got some really fantastic sort of studies to back it up. They actually, I think it's Boehringer that makes it, and they believe so much in their product that they have promos and things that run that they'll pay for the second scope, or they'll pay for the second round of treatment or something like that if it doesn't work. So they really believe in their product because it has so much stuff to back it up, and it has so much behind it. I guess the only downside with GastroGuard specifically is and honestly it is because it is so good, it can be a little bit expensive. So some people will choose to use a compounded version instead, or a human version. Now, the benefits of that is it can be a little bit cheaper. The problems with that is it's not licensed for horses. The efficacy is not as guaranteed. And traditionally, omeprazole is usually administered on an empty stomach. I scoured that GastroGuard leaflet and I could not find anything that said it had to be given on an empty stomach, but traditionally, sort of normal omeprazole has to be. And if I'm here sitting and telling you that we don't want your horse to have a truly empty stomach, we want it to have consistent access to forage, it can just make it a little bit harder to give, and that may potentially affect its efficacy as well. And then the last one is actually the injectable omeprazole. Now, again, this is off-label. I actually really quite like this product. You can see the image here is Bova, compounded by Bova. So I used it for quite a long time in the UK. It's fairly new to Canada, and I quite like it because some horses can get a little bit head shy having something squeezed in their mouth every day. The only downside with the injectable omeprazole is it is quite literally a pain in the bum to deliver. It's this really thick, like toothpaste-like consistency. So actually getting it in and injecting it is quite a nasty injection. And some horses, some horses don't take too kindly to being stabbed in the butt once a week. But I do quite like the results. I do think the results are quite nice if you've got a horse that will tolerate it. Other treatment options include sucralfate. So sucralfate tends to work quite nicely on those glandular ulcers and sometimes sort of your more hindgut ulcers. And it basically sticks to the damaged bits and acts like a protection over those ulcerated areas. And we also occasionally will use misoprostol as well. If you cast your minds back to when I was talking about the non-steroidals, the bute, the Banamine, and the reason that they can increase the risk of ulceration is because they have this knock-on effect that causes a thinning of the gut lining. Well, misoprostol is a synthetic prostaglandin, which means it sort of counteracts that a little bit, whereas NSAIDs will reduce those prostaglandins. Misoprostol will then replace those prostaglandins. So that's why we'll sometimes use that. Again, both of these are sort of off-label in horses. Management is one of the biggest parts of ulcer anything. A lot of the time it comes down to the management. So I think I'm probably sounding like a broken record at this point. Having that really continuous access to forage in the horses that are able to have that, to create that saliva, is going to make a huge difference. So in a perfect world, if we could get them out in a field and just let them graze the day away, obviously that would be the dream, but not all horses are able to do that. Some of them have metabolic disorders. That means they can't do that. Some of them have injuries, and sometimes there just isn't a field available, and maybe it's mud soaked or rocky or whatever. So then we've got to look at alternatives. So automatic feeders, that's definitely an option. Ones that are designed to sort of give a flake of hay every other hour or something like that, so that they still get that regular forage, but they can't sort of gorge themselves on it all in one go. And of course, slow feed hay nets, good old fashioned slow feed hay nets. If you don't have a slow feed hay net, you can stuff it all in one hay net and then double or even triple bag it with additional hay nets on top. And that can sort of act in a similar way. It's just a bit more fiddly sometimes. Choosing the type of forage that you have. So alfalfa hay, I love alfalfa hay. I don't know why it's got a bit of a bad rep. Alfalfa has got a lot of calcium and magnesium in it, which also helps to buffer acid. And given that it is so nutrient dense, it's got quite a lot of protein in, compared to sort of your grass hay, your Timothy hay. If you've got a horse that has really poor condition, either it's not able to eat a lot or it's just losing condition, because it's in pain from its tummy. Actually, the alfalfa hay, you're kind of getting a little bit more oomph for every mouthful. Supplements. I absolutely do think that there is a place in the world for good quality supplements. You do have to be careful because not every supplement is some of them have more efficacy than others. So you definitely want to do your reading, you definitely want to do your research. The top one here, Riley GI, that one came out of Kentucky. I think it was Kentucky. I did a lot of CE on that when I was still back in the UK, and they seem to have some decent studies on it. The other two that I kind of looked into was Egosin and Slimer. Now, I haven't done a whole lot on those. I've heard some good things about them, but I personally haven't tried them. But omega-3s, I will sing and dance from the top of rooftops about the benefits of omega-3s all day, every day, because they have benefits all throughout the body. You have to be careful about the source of the omega-3. If you use certain sources, they don't have a great bioavailability, but there is so many studies showing the benefits, the multitude of benefits of supplementing with omega-3s. And when we're talking about preventing ulcers, so the feeding again is just the same as the management, just as best as you are able to make sure that they've got something to chew on. If you're trailering, or if you're on your way to a competition, or if you're going to you're going on a ride or something, as we sort of touched on a little bit earlier, you may want to give them that sort of high concentrate to give them a bit of energy. But then if you just give them a flake of hay in the trailer, or before they're competing, it's not so heavy that it's going to sit in their stomach and slow them down, but it's going to kind of mop up the splashing a little bit. It's going to give them just something so that it's not going to be, the stomach's not going to be like completely empty. And as best as you're able to, easier said than done, I know, reduce the stress. And there's a whole bunch of different ways that you can do that as well. And every horse is going to be individual, and every setup is going to be individual. But, wherever possible, horses are herd animals. So if you're able to put them in a herd, do. If it's safe and whatnot to do so. If you are able to give them some grazing time, then please do. It might mean that they have to wear a grazing muzzle if they're maybe on a diet, or you have to you have to maybe sort of restrict how much free. Don't give them 100 acres, maybe just give them one, kind of thing. But that's going to be really good for their mental health because it's what they're designed to do. It's going to give them something to do, and of course there's all that chewing. We can't really do anything to change the weather, unfortunately, but being mindful. Do you mind? I'm talking to these lovely people. Sorry, the dogs decided they wanted to play. Being mindful of the cold, and making sure they have plenty of shelter, warm water. Again, with that forage, it fuels the fire in the cecum, keeps them nice and warm, and just as best as you're able to. It's not always, it's not always possible to do a perfect job all of the time, but if there's even tiny tweaks that you can make, then sometimes that can have a massive impact. Training method. I mean, if we're talking about stress, we know that certain training methods do increase stress quite exponentially, and others are a little bit more a little bit less intense, and they can, reduce stress. So if you're talking about like the quadrants of training, when we use the term positive, we mean to add something in. When we use the term negative, we mean to take something away. So when we say something like positive reinforcement, we mean to add a treat or a pet or a something pleasant to increase the behavior. When we say negative punishment, we mean to take away something that isn't so nice, again, to increase the behavior. So the traditional, and I'm probably saying something quite controversial here, the sort of traditional pressure release training method for horses is in many technicalities considered negative punishment. You're putting that pressure on. That pressure isn't super fun for them. So they give to that pressure, the pressure releases. So you're encouraging them to give to pressure. And if the timing is off, or if the horse is, very fearful, or maybe they haven't had a great experience with that type of training, it can increase stress. So if you have a horse like that, maybe try something like clicker training. It might be a little bit less stressful for it. And talking about training intensity as well, a lot of horses have jobs. They are very lovely animals to have as pasture pets, but they have a job to do most of the time, and they need to train for that job. You can't just take a horse out of a field and throw it into the Olympic Stadium and expect it to do anything other than probably freak out at the noise in the crowds. But where possible, are you able to cross train? Are you able to I'm just pulling an example out of the air here. Let's use reiners. They often got to do these explosive, like powerful pow, and then they've got to do those really fantastic, impressive sort of sliding stops. Perhaps instead of just doing that over and over and over and over and over again, what if sometimes you did a little bit of hill work to you're still going to be sort of working the gluteals there, you're still going to be strengthening those muscles, but it's perhaps a little bit sort of more slow and steady as opposed to explosive and kapow. Just a thought. And there's, you can use that sort of cross training in a whole bunch of different ways. And I've watched videos on trainers who even sort of do stuff on trails, which I think is absolutely fantastic. Just gives them a little bit of something else to do. Obviously, run regular dental checks, make sure those teeth stay in good condition. And then, of course, preventing and reducing pain wherever possible. We spoke about how pain in other parts of the body or stress in other parts of the body can increase the risk of ulcers. So make sure your saddle fits. That's a pretty easy one, I think, relative to some of the others. Just make sure you've got a nice fitting saddle. Make sure that you're conditioning your animal. I couldn't run a 10-mile, or I couldn't do a 10-mile hike after sitting on the couch for 6 months through winter. So I wouldn't throw a saddle on my horse and expect them to carry me 10 miles up a mountain after sitting in a field for 6 months over winter. Making sure that you're doing appropriate warm up and cool down. This is more of like a preventative injury, because if you've got a pulled tendon and you're sat in that stable on those NSAIDs for a prolonged period, away from your buddies, away from your friends, then yeah, that's a perfect storm for them. So these real simple, just adding in a couple of minutes just to make sure that we're preventing any external damage. And if there is an injury, or if there is a painful condition, or if there is something that, where you can't get away from those NSAIDs, consider using a multimodal approach rather than just blasting them with a massive dose of bute. Consider using maybe a lower dose of bute, but also some laser therapy or some acupuncture or some massage or something like that. So you're still targeting the pain. You're still making sure the horse is comfortable, but you're not just relying on these really harsh NSAIDs, like high doses of harsh NSAIDs to do it. And if you do use an NSAID, choose one that's maybe a little bit more stomach sensitive. So everyone knows butanedione, and they absolutely do have their place in the world. But if you've got a horse with a history of ulcers, maybe choose something like Prevequine. Some people know it as Previcox, or Firocoxib is the drug name. It's just a little bit more selective. It's a little bit less likely to damage that stomach lining, but it's still an effective anti-inflammatory. So it's still going to help with pain management. It just might not be quite as high risk for some of those ulcers. Okay, I think we're coming towards the end now. Yes, so this is my list of references. So thank you to everybody on this particular page. And this is my thank you page, which, oh, there we go. Okay, I don't know why I did that. So Q&A, please do ask any questions, and shameless plug. We've actually got a really fantastic new gastroscope. So if anyone is listening to this and gone, oh yes, I think that might be a good idea, please do feel free to grab the QR code. We're running them every month, and the next one is is August 5th. A shameless plug for our Saddle Clinic date. We've got, so that's actually the old poster on there. So we are there's a new date to be decided. So just shameless advertising in there if anyone is interested. But I will stop talking about the cool stuff that we've got coming on, and I will see if I can find the questions now. How am I going to do this? How can I do this?
If anyone does have any questions, they can add it into the chat, and then we'll be able to see it. I know I have a question as well. If you were to recommend kind of a preventative treatment thing for each horse, what would you say the duration? Like, would you, recommend someone scoping a horse every couple of years, once a year? Is that kind of like, what does that kind of look like?
Oh, that's a great question. I don't think I've ever been asked that before. I think it's going to depend a little bit on the individual horse and kind of their individual job. So, and that's not a very good answer. So, if you've got, a sport horse that's expected to train very intensively, they really need those concentrates in their diet, they've got a lot of stress. I might be scoping potentially every 6 months, maybe, like, especially if they have a history of ulcers, especially if they have a history of severe ulcers. Your pasture pet, maybe I might only do them if they've had a really bad winter, or if they've had an injury or a bout of laminitis. I guess the other thing is, I know that I spent quite a lot of time talking about how it's not always easy to tell, and it's not always easy to tell, but some people know their horses better than they know themselves. And if the client came to me and said, there's something wrong, there is something wrong, then I'm going to believe them, right? Even if they're not showing the classic signs that I would look for. If they're saying there's something wrong, then we're going to keep digging until we find it. And a scope would probably be on my list of things to look for in those cases.
Is there ever a world where the horse's like system will actually kind of help heal the ulcers? Like if left untreated, will they always move from like grade 1 to grade 4? Or if the horse is the same kind of management, will it kind of stay the same? Or the body try and fight it on its own? Like what happens if they're kind of left to their own devices?
So the body's always going to try and heal itself. That's the beauty of medicine in general, and that's one of the reasons that I will make a terrible mechanic, because cars don't heal themselves. Um, I guess a lot of it is going to be whether or not the external factors that are causing it are addressed. So if you take, let's say you take a racehorse off the track, and then you put them in a field and turn them out for a year with grazing, and they suddenly go from a very intense, potentially very stressful life to a very mellow life. Reasonable chance those ulcers are going to improve, maybe even completely clear up with just those management changes, because you've addressed those underlying issues that caused them in the first place. If you were to just leave that horse in that same situation and not address anything, chances are they're probably not going to get better, just because the situation hasn't particularly changed.
Yeah, I think that makes a lot of sense, especially for the horses that you think are kind of having the same job. Like they're always kind of expected to go to the clinics and the shows. They may have an off season, but they kind of go back to the same environmental pieces that may be causing those again. So yeah, it does kind of make sense that the body wants to heal, but we also have to kind of support them when we are asking bigger questions, essentially.
One of the things that I sort of forgot to mention, some people will sort of preemptively treat with omeprazole sort of ahead of a show or a stressful event. Um, I'm going to be honest, it's not something that I've done a whole lot of, but I also can see and understand the logic behind it. So, if you know that your horse does get very, very stressed traveling, then you give them a dose of omeprazole before they jump in the trailer. At the very least, you're kind of preventing the acid from, because you're going to reduce the acidity in the stomach sort of temporarily. At the very least, you're going to be just offering them a little bit of a buffer during that sort of stressful period. Um, I'm not sure if it's necessarily advisable to just treat with omeprazole just throughout the showing season, just in case. I feel like there's probably better ways, but certainly the odd go here or there may be beneficial for some horses.
I feel like you've offered a really well-rounded approach with the hill training and the cross training and just, saddle fitting. Like there's so many pieces to this horsemanship kind of style of things. So I think that's, yeah, very, very important. Honestly, again, thank you so much for your time. Thank you for your expertise. I really feel like, I know I got a lot away, took a lot away from it. I'm sure everyone else sitting here feels the same. We will be having another webinar probably in the fall. So everyone stay tuned for that. The next topic will be no hoof and no horse. So taking a look at the performance horse from a farrier's perspective and how you can really collaborate to, again, support your horse and their goals and your goals and obviously work together. So thank you again. Please check out Countryside's QR codes here and let us know if you have any questions and enjoy the rest of your day. Bye, everyone.
Thank you.